Hello, and welcome to the CivilNet studio. I'm your host, Paul Vartan-Sukiasian. Today, my guest is someone working at the intersection of medicine, diaspora engagement, and sustainable development in Armenia. Dr. Krikor Deramerian is a pediatrician with Kaiser Permanente in Los Angeles and the chairman of MedAid Armenia, an organization focused on establishing preventative care as the cornerstone of Armenia's healthcare system. He's joined us today to talk about how sustainable healthcare change is possible in Armenia and what it takes to get there. So thanks for joining us, Dr. Deramerian.
Thank you for having me. Pleasure.
Well, we're going to start off with the basics. How did your personal journey as both a physician and a diasporan shape the creation and direction of MedAid?
Definitely. Gosh, a long story, brief. We're all a product of our experiences. So very much attached to my homeland. Going through medicine, I had the opportunity to come to Armenia early 90s and on a kind of information gathering project. And I learned more or less where it was pretty much a, difficult situations they had. And one example that really kind of moved me to refocus, reshift my thought process was I was in a neurosurgery hospital and the director told me they were sharpening their scalpels on barber leather straps, which was crazy. And before I went to Armenia, I'd grab whatever I could. I used to be a medic for the intramural games, so whatever I can grab, take with me. I did, and I happened to have a bundle of scalpels. So I don't know how, but I did. So I gave it to him, and he was grateful, but he said, so what do I do after this? So then I realized this is not just a one-time you come in. My objective there was to gather information on who, what, where, who needs to go where, what they need to bring with them, or where is it needed. But it was a little bit beyond that. So that's really kind of geared my shifted my approach. So fast forward through med school, residency, life, family, I was trying to come back and I wanted to kind of walk into it with that approach. And I had a great opportunity, 2018, when I was here on vacation. I had truthfully almost given up on doing anything because whenever I tried, I was not able to connect to or attach to anything to be helpful. And Peter Abajan, Powers Foundation, I just was connected to him and I said the words, how can I help? And then I started the whole project over there. And that's kind of how it started.
Oh, well, it's magical how, things like that just meet the right person and a lot of things can happen in Armenia. So something, you're talking about, one of my first memories of engagement with Armenia from the diaspora as a young kid. And I remember from the earthquake especially, there was a lot of people going, and then it was needed, triage. I mean, we needed all hands on deck, bringing people to the US to get help. And ever since then, we have had this back and forth as Armenia has opened up as an independent country. It'll be once a year, maybe a group of doctors go to some remote villages, do whatever they can. But as you're saying, then what? And so it sounds like while, of course it's a noble cause to do, there could be actually some problems and impact, difficulties that might stem from this approach. Can you tell us about that?
Absolutely. Kind of taking one step back to really flesh that out. So MedAid Armenia we started, and Peter's asking me, which was I thought over my head, was bring Western standards of medicine to Armenia. So I really developed the two buckets. The one bucket was MedAid program, which would come here once a year, and we take care of kids and adults. It's kind of the mission style, but that to me was more the opportunity to learn, and also engage diasporans to come over here. My other bucket is to create projects or programs to affect and improve the healthcare available here. So when those examples you gave, that's what was needed at that time. So there's a time for everything. So in an acute crisis situation, kind of like a trauma situation, you deal with the situation at hand. But as that evolves, as that improves, you have to start shifting. You have to start shifting to improve the care delivery here, not because of you, but what's available here. And that's where really the challenge comes in. It's really easy to come in, do the good deed for 1-2 weeks, and you do a good deed, but then you leave. So what happens with that? So where does the problem come with that? So the problem comes with that is what happens to them afterwards. And there are physicians here who take care of them. And what happens there is that that the population, the patients, start having a certain level of distrust or lack of connection to their physicians, saying, well, these diasporan Armenians came and they took care of us. Why aren't you able to take care of us? And there's good reasons: resources, knowledge, medications, various things. So we kind of came in, hovered in, took care of it, and left. We kind of leave this kind of space, this gap. And that gap is very harmful. And we want to be able to, when we leave, fill that in so they don't feel that gap. So fill it in to a sustainable way for them to improve the care they're getting.
So it sounds like part of this is because, I mean, for example, you can't be here all the time. You have your life and practice back in the U.S., but at the same time, you're factoring in, education and capacity building as long-term goals for the physicians that are here.
Yes. So when I come here, I'm here about 2 to 3 weeks every year, at the minimum. And when I'm here, I do the program, and then I look at where opportunities exist. So in overarching, I try to bring what I do in Kaiser Permanente to here, in a sense of preventive care, education. Once I started here, when I go back home, I continue that program. I have virtual meetings, and I set up what goals have to be achieved, what are the objectives. So I have meetings 3 times a week early in the morning with my counterparts over here or the people that I'm working with here to see what progress is being made, what's going on. So it's a continuous effort all the way through. So I don't go home and done until next year. It's a constant, and then when I come back, I see where things have gone and then improve that, and then opportunities come up. And as you mentioned, you meet people in Armenia, if you hear it often enough, and these opportunities come up to really do more. So that's where the continuity comes in. There are several programs I've started. One is called ACEs program, Acute Adverse Childhood Events program. Another one is a hearing screening. So we have neonatal hearing screening in Armenia. We don't have any hearing screening after that. So back home, all kids 4 and older get hearing screenings. And then there's the whole approach to medical care is outcome-based. So we're really trying to want to be able to look at what are we really doing, what are we really achieving. So to do those, you have to set up programs. It's not a one-shot deal, and that takes regular engagement. And finding the people here who are motivated and who are willing to participate and then achieve those programs.
Oh, well, that's really interesting because, I mean, just imagine if everyone that came here for one of those, drop-in quick things, just even once a month, had a little bit of a follow-up or something. I mean, that sustainability really gives dividends. So something I want to bring up is an issue that I've really seen in the diaspora in the past few years. I mean, we've been through a lot of demoralizing times with the war, the ethnic cleansing, the repeated attacks, and this general feeling of, what's going on, lost in this region that is on fire. And then there's a whole lot of animosity and anger directed at the government, and everyone has their reasons. But it's making a lot of people kind of either burned out or wanting to give up on Armenia. There are still ones that want to be involved too, and we want to encourage that. But I mean, it almost feels like people find reasons not to do something. I've been told so many times, it's dangerous over there, be careful. I mean, when we walk around Yerevan, and it's the safest thing. We know people that have repatted and are doing amazing projects here who get basically insulted and ribbed by their friends at home, yeah, don't you wish you were back here? And oh, can't believe you're doing that. So, I mean, what can we do to kind of change this negativity and get rid of these just harmful myths that are out there about Armenia?
That's a tough one. I think my approach is the best I can do is be the change that I want to see, in a sense. Be the example. So when people ask me, tell me this, and I'll tell them, well, I've been bringing my family here for the last 6 years. We all come, so my kids, my wife. So if I thought it was anything that was unsafe, I would not bring them. We go down to the southern part of the country, Barisevak village on the border of Nakhichevan. We go to Goris, different places. So, we have, we want to be safe as well, and we're not going to take any risks. And it's the best I can tell you is I take my kids to Armenia every year. And what I tell them is, I want to give you the opportunity that I never had. And that's one thing that brings diasporans here, is there's that energy they want to come and do good. So I want to try to help them bring that energy here, but in a design, program, sustainable way. Not just a one-off thing and go home. So they can feel like they're part of something bigger. And I think when you have a bigger sense of why, a bigger sense of belief, it will start to overtake a lot of that news or a lot of that negative or modified information you get that really does not hold. I come here, Yerevan, every year, people tell me, what are you doing going? When I get here, I show them on the phone, like, this is what it is. I mean, this is my on-the-ground reporting to everyone, and they're surprised. So, and I'm not going to get everyone, and that's fine. But the people who are truly interested, and their why is to help, and their why is to engage and help people of Armenia, I offer them the best opportunity they can to be able to come and do that.
Yeah, there's just some people out there that are seething with anger, and people have their reasons for being angry. But when, there's other sides to Armenia. There's a lot of exciting things happening here, and this is just one of them that they can also be involved in and rechannel that anger. That's if I could encourage anyone anything. What do you like? What do you enjoy? Everyone from the diaspora has some kind of talent that they can bring to Armenia and synergize it with what's already going on here. And take 5 minutes off from just being angry about the politics and the politicians and everything that's happening and just focus on the now. So when it comes to your project and MedAid, what would success look like in terms of actual patient outcomes or a systemic change?
Great question, because my objective is not to constantly come here and do this. My objective is to make the healthcare better here. And I do that in many ways. So the ultimate outcome would be the physicians here, the system here has the capacity and capability to continue the growth on their own and provide the best care possible to the population in hand. And that would be my ultimate end game. And to achieve that, I have engaged myself in any way possible. So there are various amazing programs here in Armenia. So, and unfortunately, they're not very well known. So there's a pediatric residency program called PrEP. So coming here often enough, I've gotten to know most everyone that's in similar engagement in the healthcare arena. So I give about once a month lectures to the pediatric residents. There is an amazing program for emergency medicine started here. Sharon Chekijian out of Yale, she started a program here to elevate the emergency medicine, actually create the emergency medicine discipline here. That is a huge undertaking. So when you see this, and all of us are dedicated equally, and we all have our abilities, our bandwidth, if you want to call it, and resources, we do what we can. So I've given lectures in that program, offer what I can do, and I was trying to make myself available to do that. So whatever programs there are that have this improved native abilities, I lend myself to do that. And my ultimate goal is that those all succeed so that we can let them stand on their own 2 feet. That's the objective.
And one more thing. I know that there are some issues when it comes to medical data in Armenia and how data works in your model. And so why is building a culture of outcome-based care so critical for Armenia and the healthcare's future here?
Excellent question. So I came across this early on, and I kind of did a lot of observing. So a physician would see the patient, they'd give them medication, be it hypertension, diabetes, whatnot. And I say, well, how do you know what your outcome is? They said, what do you mean? I gave them medicine. I said, okay, so how do you know they've actually made a difference in their morbidities and outcomes and all those things? To do that, you have to have data you can follow. You have to be able to follow their certain metrics, certain laboratory tests, certain measurements. If you don't have that, you're kind of just flying blind. You're just doing acute care, that's all you're doing. You're not doing preventive care. And the preventive care is, as you're able to follow the patient, you see their, for example, blood pressure is not improving, you need to change what you're doing. If you look at their diabetes metrics, it's not improving, you need to change what you're doing. They don't have that ability. So that's a very big project I've taken on. Try to find a way to get some basic data so that an average polyclinic can collect the data, look at what they're doing so that ultimately it's an outcome-based care, not just an acute care. So that everything I do, I model it, can this be replicated in any polyclinic? So I work with the Norwegian polyclinic. It's about half an hour north of Yerevan. And I work with them because they're very receptive, very engaging, and they're ready to work hard. And I've been very upfront with them on this. And they're, to this day, over the last 3-4 years, they have not failed me. There's challenges by far. And so the idea is to change their culture, how they deliver care, so that they can actually have outcomes. And I told them again, so my goal is to have the population in Norwegian have one of the best health outcomes in Armenia. Diabetes rates go down, hypertension go down, not get rid of it, that's going to be almost impossible, but bring it down, improve it, so that people have a chance for health and happy lives.
Well, I mean, it's great to hear this kind of story because, as you said, 6 or so years ago, you weren't doing anything and didn't know how to do anything. And I feel like there's a lot of people at home in the diaspora who also have that drive or desire to do something, but they might think, what can I do? How? But you showed it's possible that you can do it, they can do it. They don't have to form their own organization, but there's so many ways they can get involved. So thank you for coming and letting us know about what possibilities there are.
Thank you for having me. It's a pleasure.
And thank you for joining CivilNet.